Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's learn about ICD-11 coding or ICD-11 version. Uh, so we will learn what is ICD-11, what is ICD-11 MMS, and the key features of ICD-11, history of ICD-11, and when can ICD-11 be accepted in US healthcare, and ICD-11 chapters, benefits of transitioning to ICD-11, and the challenges in adoption. And also, at last, we will conclude with the summary what we have learned. So before moving further, I just want to clarify few things. So please note that if you are currently preparing for CPC exam, you need to study ICD-10 CM only. Okay, and you should not have any confusion. Should I learn ICD-10 or should I learn ICD-11? You don't have to worry about ICD-11. You should only focus on ICD-10 CM because the US healthcare is utilizing ICD-10 CM coding process, not ICD-11. So that is why I am taking this video to make you all clear regarding ICD-11 coding process. So what is ICD-11? ICD-11 stands for 11th revision of International Classification of Disease developed by World Health Organization to standardize diagnostic codes globally. So what is the purpose of ICD-11? It is to track the disease, injuries and cause of death worldwide, and it is also improves the global health data exchange. WHO, they came up with ICD-11 version just to make sure that all countries that throughout the world or across the world, they need to follow single version of ICD coding. So it will be even more helpful to have the data exchange or to classify the proper health records. Okay, and also as I said, it will also help the healthcare providers, researchers and policy makers throughout the world. So next, what is ICD-11 MMS? Okay, ICD-11 MMS stands for ICD-11 version for mortality and morbidity status. Okay, so here you can see it's a specialized version of ICD-11 focused on standardized reporting. What is the purpose? To ensure the consistency in death certificate and the disease monitoring aligns with WHO's Global Health Initiative. So, as I said, it's a specialized version of ICD-11 and it is designed for tracking mortality and morbidity data. And here, what it will do, it will ensure the consistency in reporting cause of death and also disease statistics worldwide. And again, it is essential because to help the countries and the standardize their health data and to align with WHO's official guidelines or global health initiative. Okay, so ICD-11 MMS is mortality and morbidity statistics. So we have like a special set of codes and special set of coding guideline. So that is again it's a different chapter to understand and learn. What are the key features of ICD-11? So it is a digital first format designed for electronic health systems. So here it is the first time in history that it's like a tool. ICD-11 is a tool and we now also we can access ICD-11 for free. Okay, and as I said, it is designed for electronic health systems. Next, greater clinical granularity. So here again, as I said, it will be having more specificity, more than ICD-10 version. Okay, it's a greater version. And then multilingual support. So here since we are going worldwide, since it is a globalized a system, ICD-11, so they are offering multilingual support. Okay, not every country is good in English. So they want in their language. So here it is a multilingual support. So they can access in their language. Okay, so as of now, many countries are utilizing ICD-11, and here they're also accessing with their languages. Okay, and then integration of traditional medicine. So for traditional medicine also ICD-11 can be used. Traditional medicine such as like we can say like herbal remedies and acupuncture or some other allopathy. There are some traditional medicines, right? Naturopathy, all of this also can be coded with ICD-11 codes. And next, enhanced tool for morbidity and mortality statistics. As I said, as we discussed, ICD11 MMS. So it's a specialized tool for morbidity and mortality statistics. So these are the features that we can see in ICD11 version. So coming to history of ICD11, like I have kept it very short, and I don't want to make it lengthy video, so I kept it short. So here the history, who developed this? WHO has developed this, and again it was released in 2018 after a decade of development. So already ICD-10 was being used. Then the WHO introduced ICD-11 in 2018, but officially entered into effects globally on January 1st, 2022. So in the January 1, 2022, they come up like they implemented ICD-11 in few of the countries. Already, as I said, many countries are utilizing ICD-11 process. Here in India, we are utilizing ICD-11 only. Okay, if you go to any kind of specialty hospitals, most of the hospitals are using ICD-11 coding. So, but US healthcare not yet accepted ICD-11. Why I will tell. So next, when can ICD-11 be accepted in US healthcare? So as I said earlier, as we are working for US healthcare, okay, so if you are preparing for CPC exam or any exams from AAPC or AHIMA, that means we are going to work for US healthcare. So then we should learn ICD-10 CM. Okay, the 10th revision clinical modification only we should learn. But according to WHO motto is to make the ICD-11 globalized. That means US also included in the world, right? So US also must accept ICD-11. But they have given the time frame. It's not so easy, like we cannot easily switch, like we cannot make the smooth transition just like that. Okay, because we many coders, lakhs of medical coders are there, and they are doing ICD-10 CM, and they need to learn ICD-11, and the whole system needs to be integrated with ICD-11 codes. Okay, and every provider, payers and the stakeholders, every input is needed here. Okay, since the US is like a foundation of the medical coding, it is having the large portion of medical coders, right? So it cannot be like the decision they cannot take so easily. So they are working on it. US healthcare is working on it to implement ICD-11 in the coming years. Okay, so that is why we should be aware. We know how to code ICD-10, and we should also start accepting, or we should be ready to learn ICD-11 when the US healthcare accept the particular ICD-11 version. Okay, so whoever already learned ICD-10 CM, it will be easier for us. So few things will change. I will tell you that what are the things we need to learn extra. So that's it, everything will remain same, not the codes entirely, the code system will change, but the guideline and the conventions, that is going to remain same. So now you can see the current status. Currently USA still uses ICD-10 CM only, the modified version ICD-10 CM clinical modification only we are using. And factors for adoption. So as I said, it require adoption into US specific version ICD-11 CM. Like we need to take the stakeholders input, include healthcare providers, insurance and policy makers. Time intensive process. So we need to test and then training is needed, and then updating the systems. Okay, so when they agree to accept ICD11 version, they first have to take the trials. Okay, how it will go, because they need to train so many members. So ICD testing will take place, and then if testing works, if they get to know, okay, it is going to happen smoothly, then they will start giving us the training. Okay, not individually, but they will have some kind of sessions will be there. And if we join any organization, definitely they will give, because it is not the new thing. Previously ICD9 version was there, now ICD10 version is there. So whoever coded in ICD9, they are coding with ICD10 also. Same way, in future we may have to code with the ICD11 version. That's it. So after that, once the training is done, they will start updating their systems, because it's a huge data needs to be integrated for all the medical coding softwares. So they will be uh, integrating all the data to that. So potential timeline, full adoption could take 3 to 5 years depending on the regulatory approvals. So here, when WHO, as that when they made in 2022, the implementation took place, right? That time only WHO has passed an order saying that every country must use ICD11, but they were ready to give some time frame, like we will give some time for you to prepare. You prepare well, and within this time frame you should also accept ICD11 version. Okay, likewise WHO has passed the order. So the potential, as I said, the potential adoption could take 3 to 5 years according to WHO. Like from 2022, if maximum 5 years means, we can expect this ICD11 implementation in US healthcare from 2026 or by 2027. Okay, as I said, it depends on the testing and training. Okay, if testing is not working, like if they are unable to have the proper things, that whatever they planned, definitely they will ask few more years time frame. So again, it depends on the US healthcare, but as of now, according to WHO article, it is likely US healthcare is likely going to accept ICD11 by 2025 October to 2026 October time frame. Okay, that is why I am making this video. If they are not accepting, then it's well and good, we can go with the ICD-10 CM version. But if they accept, we should know the future. Okay, that is why I am putting it out. So next, coming to ICD11 chapters. Okay, so here I have complete the content of ICD11, but I'm not going to discuss in this particular video, because if it is not get accept, it will be a waste of time, right? So that is why. So I will just give you an overview, like what we need to learn extra. So what we need to learn extra in current ICD-10 CM, as you all know, we have 22 chapters. The first chapter would be infectious parasitic disease, and same way chapter 2 is neoplasm. Likewise, we have 22 chapters, and we have a specific coding guidelines for that, and we have ICD-10 conventions. Okay, general coding guidelines, everything we have, and we know for ICD-10 CM coding. Now when we accept ICD-11, what and all we will learn? So there will be an increment in chapters. Okay, for because as I said, it is having a greater specificity. As I said, it is having a traditional medicine as well, mortality and that morbidity statistics will be there. So you can see here increased chapter count from 22 to 28. 28 chapter you can expect in ICD-11. And again here you can see the traditional medicine extension codes, like now in ICD-10 CM how we are utilizing use additionals. So likewise, whenever we have a single ICD code medical condition, that we say as a stem code. So single stem code which requires an additional code for more specificity or more details, we will utilize extension codes. Okay, again here we have few concepts like pre-coordination and post-coordination, and there is a concept like cluster coding. Okay, so there is so much to learn that no need to worry about, like currently you don't have to worry about that. And then you can see supplementary chapters. It contains optional codes for external causes, functioning and disability functions. Special code groups like X and V chapters. Extension code enhance the specificity in coding describing additional details about the condition or situation. And V codes capture functioning and disability classifications, which aligns with WHO's and also ICH's, okay, international classifications of functioning. So based on this ICF and WHO's framework, we will able to learn the ICD11 coding guidelines, when US accept it. Okay, but if you are looking job in India, you can learn ICD11 and you can also be an insurer coder for Indian hospitals. Okay. So now coming to benefits of transitioning to ICD11. So as we discussed, it can give us an improved health data for research and policy. So we were discussing ICD11 MMS. So the mortality and morbidity statistics, the cause of death. We can get to know how many deaths are happening and what is the cause for the death, and for the particular death patient, what kind of treatment was given, okay, for which kind of treatment patient was survived. All of these things we will be able to extract when we make the thing which is globally. Okay, when we extract data globally, we will have some more insights or inputs regarding health maintenance. So next, better integration with electronic health records. Since ICD11 tool is an digital friendly, we can integrate directly with the EHRs, and then more accurate and detailed clinical descriptions. So it, as I said, it provides granular codes that better represent complex medical condition, leading to improved diagnosis, treatment and monitoring. So here it is not only the ICD11 is not only about focusing on diagnosis. Instead, with the diagnosis, they are also concentrating on what kind of treatments, monitoring globally we have, and what is working, what is not working. So everything, complete statistics, the WHO can get. Okay, so that is the purpose of ICD11. And coming to the end of the PPT, I just want to make you all clear that, as I said, if you want to be a medical coder for US healthcare, you need to learn ICD-10 CM for the current year. Okay, and if the US healthcare accept ICD11, I will only make a video about how to code and the few things that I can also put it. Currently I'm taking training, and if I feel confident enough to teach others, I'll definitely make videos on how to code ICD11 coding. Okay, and as I said, if you are pursuing any kind of certifications from AAPC or AHIMA, please do not worry about ICD11. And as I said, if we already know ICD10 coding, it will be more easier for us to understand ICD11 coding in future. Okay, already we will be knowing the general things, general coding guidelines. Okay, when to use additional codes, when to use code first codes, all the conventions we will be aware. And in future, we can easily learn ICD11 version also, but be prepared. Okay, so that's all. Thank you guys, thank you for watching. And if you like this information, or if you find this insightful, please subscribe to my channel, and please do share with your medical coding friends. Thank you all, thank you for watching.